All right. Good morning, everyone, and welcome to the Maricopa Regional Continuum of Care Committee meeting. For all participants, please mute your phone or computer when not speaking to minimize background noise. And please don't put your phone on hold. It could create a music pattern for us that we don't need. For all participants, we ask that you identify yourself when speaking for transcript clarity. Committee members, just a reminder, don't use the chat function. We know it's fun, but the audience watching cannot see it, and this is a public meeting. We wanted to also welcome Gerardo Pena from Chicanos por la Casa. He is taking Nikki's seat on the committee moving forward. Gerardo, we're really happy to have you on the committee. We will proceed with a roll call. When Katie calls your name, please indicate that you're here and your organization name after Katie calls your name. Thanks.
Thanks, Wendy. Don Bogart. Don, you are on mute. I think you're here. Melody Boyer. Vanessa Cartel.
Here.
Sylvia Chavez.
Hi, Sylvia Chavez, Arizona Department of Education.
Ashley, I'm going to mess up your last name. Zagonic for Allison Davis.
Yes, here from the Morrison Institute.
Erin Cohenhag.
Good morning, everyone. Erin Cohenhag from Save the Family.
Richard Cruz.
Richard Cruz, Human Services Campus, present.
Jessica Cruz.
Jessica Cruz, Housing Authority of Maricopa County.
Kathy, you're on mute.
Are you able to hear me or no?
Yep, Jessica, you're good. Kathy Dinolfi.
Present, a new leaf.
Bernie, I'm also going to mess up your last name. Peralta for DC Ernst.
Yes, good morning, Bernie Peralta, Phoenix Fire Department Community Assistance Program. Great job, pronunciation.
Thank you. Nicole Gibson.
Nicole Gibson, UMOM.
Wendy Johnson.
Wendy Johnson, present, Justice Center.
Anne-Marie Johnston. I know you're here. I think you're on mute. Christina Lopez.
Christina Lopez, Native American Connections.
Marcy McFarland.
Marcy McFarland, Home Inc.
Jim McPherson.
Hi, Jim McPherson, Phoenix Community Alliance.
Jennifer Page.
Good morning, Jennifer Page from Mercy Care.
Geraldo Pena.
Hi, good morning. Geraldo Pena, Chicanos por la Casa. Glad to be on board.
Ty Rosensteel. Sheila Schuster. Sarah Sims. Laura Scott Nicky.
Laura Scott Nicky, present, Salvation Army.
Lynn Spillers.
Lynn Spillers here with City of Mesa.
Michelle Stokes.
Michelle Stokes, Behold Charities International.
Craig Tripkin.
Craig Tripkin, Central Arizona Shelter Services.
Jocelyn Wilkinson. All right, Chair, back to you.
And that's me. So the next item is our call to the audience. Members of the public were given an opportunity to submit written comments relating to this meeting to the azmag.gov comment section within 1 hour of the posted start time for the meeting, or they can join the Zoom meeting by requesting the link from MAG staff or registering on the COC meeting event page. If you are wishing to make a comment, please raise your hand in Zoom. You'll be invited to unmute at that time. Public comments are limited to 3 minutes. Meg, staff, Katie, are there any comments received or anyone who's joined the call?
Madam Chair, no comments were received and no one at this time who's joined the call has raised their hand to speak.
Oh, thank you. We'll now move on to the next agenda item. I get to do all the fun stuff. Richard has to do the heavy lifting. So our next item is approving the February 9th meeting minutes. Does any member of the committee have any questions or comments on the minutes?
Yeah, this is Laura Skotnicki with the Salvation Army. And my proxy is not listed, but was in attendance in February's meeting, which is Kimberly Thompson.
Thank you, Laura. Katie will make that correction. Any others? If no other comments, could I have a motion to approve the February 9th Continuum of Care Committee meeting minutes with the noted attendance change?
Richard Cruz, so moved.
This is Kathy. I'll second.
Thank you both. Is there any discussion related to this motion? Okay. I will ask Katie to proceed with the roll call. Please indicate clearly how you vote, yay or nay, after your name is called.
John Bogart,
Yay.
Melody Boyer, Vanessa Cartel,
Yay.
Sylvia Chavez,
Yay.
Ashley Tizganic,
I'll abstain.
Erin Cohen-Haig,
Yay.
Jessica Cruz,
Yay.
Kathy Dinolfi,
Yay.
Bernie Peralta for DC Ernst,
Yay.
Nicole Gibson,
Yay.
Amory Johnston,
Yay.
Christina Lopez,
Yay.
Marcy McFarland,
Yay.
Jim McPherson,
Aye.
Jennifer Page,
Yay.
Gerardo Pena,
Yay.
Ty Rosensteel, Shayla Schuster, Sarah Sims, Laura Skotnicki,
Yay.
Lynn Spillers,
Yay.
Michelle Stokes,
Yay.
Craig Tripkin,
Yes.
Jocelyn Wilkinson. The motion passes with one abstention. Back to you, co-chair.
Thank you so much. We'll move on to the next agenda item, and Richard.
Awesome. Good morning, everyone. Hope everybody's feeling good and feeling great. The written updates were included in the packet. One additional update is that the Coordinated Entry Subcommittee in January unanimously voted Jasan, I apologize if I said her name wrong, Goodman as the second co-chair of their committee to work alongside Matthew Kelly. Does anyone have any questions about the update memo? Hearing none, okay. Now moving to the next agenda item, which is the legislative update. As you all know, it's that spicy time in Arizona where we are in the midst of a legislative session. We wanted to make sure that we give you all time to really dive in and sink your teeth into some of the issues that are going on right now. So we will have Joanne Service with the Arizona Housing Coalition, who will provide an update on the current bills and legislation. Y'all take notes so we can ask questions and talk and engage afterwards. Thank you so much.
Hi, good morning, everybody. Can you guys hear me okay? Okay, I see nodding heads. Great, fantastic. I'm pulling up all my folders on all the bills, and apologize to several of you who have heard me probably numerous times around updates around the legislative bills, but buckle in because there's a lot to talk about. So I think the last time I was here, or maybe I never talked about this, but there at the beginning of this legislative session, the good news is that lawmakers are really finally paying attention to our issues of the lack of affordable housing and how to, what the state can do to address the increase of folks experiencing homelessness. That's the good news. How they do it is the question mark. So how much time do I have? Because I could go on for hours.
Joan, you have about 15 minutes. So
Okay, I'll try and be brief. Okay, so lawmakers paying attention. Beginning of the session, there was some legislation introduced around changing zoning to create more affordable housing. On its face value, we're like, yay, that's so great. But it definitely focused on the housing supply side, not so much on the housing affordability side. Because we're not a big proponent of what really is called trickle down housing. We can't wait 30 years. We need now strategies. So unfortunately, or fortunately, however you want to look at it, that those zoning bills have kind of withered. But what it did do is created a lot of conversation. That's always a good thing. It created some good proposals, some good talking points, and it represents some healthy tensions between both the kind of developer side and the local municipality side. But in reality, both are good advocates for affordable housing. They just need to have the political coverage and the appropriate messaging, frankly. So that will be a continuing conversation, possibly through a study committee. So that's that. In addition to that, we had a group of bills, and I'll say them for folks who like following bill numbers. Senate Bill 1581, Senate Bill 1531, Senate Bill 1263, and Senate Bill 1117. All four of those bills were adopted as, were proposed to be heard through the Arizona Senate as a bundle, even though it's not required to be that way. The reality is those four bills were introduced, well, three of the four were introduced by Senator Livingston, a Republican lawmaker representing the Peoria area. One of them, Senate Bill 1531, was actually introduced by Senator Alston, one of our big housing trust fund champions. Now, but she worked with Senator Livingston to basically create this kind of bipartisan package to address housing and homelessness. And that's why it was kind of shopped together and passed together. So the kind of elephant in the room is Senate Bill 1581. I think that its current short title is Housing, Grants, Homelessness, Camping, Appropriation. And what this bill does, and this is actually the second time something like this has come back at the Arizona legislature, but what it proposes to do is develop sanctioned camping sites and use 50 million of the American Rescue Plan Act dollars to incentivize cities and towns to enforce their camping bans. And then there's also $20 million to nonprofits to work with, there's been some amendments, $20 million to nonprofits to, again, work with the local municipalities and to support the sanctioned camping sites. I'll just speak from the Arizona Housing Coalition. The Housing Coalition basically saw this bill, has expressed some concerns, testified in committee, elevating those concerns, the biggest being whether or not this is constitutional. Obviously, Arizona falls under the Ninth Circuit Court ruling that individuals experiencing homelessness can't be punished for sleeping outside in the absence of adequate alternatives. The proponents of the bill believe that these sanctioned camping sites would be potentially adequate alternatives. So we expressed our concerns at committee. We were told that there would be a stakeholder meeting follow-up. We were a part of that stakeholder meeting follow-up. The proposed amendments were not sufficient enough in our opinion. So we are, the Housing Coalition is in opposition for this bill. We do believe, and some of you all have been invited, we're doing another stakeholder meeting. There's been a couple of stakeholder meetings so far around this bill to see if we can articulate line by line all of our concerns with this bill, as well as see if there's a way we can propose some amendments to it. Because as I think I shared, it's passed out of the Arizona Senate. It's now in the Arizona House of Representatives, a completely different chamber. Those bills being considered as a package, that was a strategy for in the Senate. we're hoping that they will be viewed independently through the Arizona House of Representatives. And the reason why we say that is because the Senate Bill 1581 is the one that causes us consternation, but Senate Bill 1531 and Senate Bill 1117 are things that we're quite in support of. Senate Bill 1531, that basically allocates $100 million from the American Rescue Plan to the State Housing Trust Fund. Again, a very flexible and nimble policy lever to address the whole continuum of housing insecurity, from street homelessness all the way to home stability. And then Senate Bill 1117 basically removes an arbitrary cap that affordable housing developers, right now it's, if you want to have property tax abatement, you can only build up to 200 units. This would actually increase it to 600 units. It's rather arbitrary that it was set at 200. So we just want to have maximum flexibility, maximum units built, and then we want to make sure that there's some property tax relief so that those property tax bills don't end up getting, borne by the future residents of those units. So happy to entertain any questions or comments around any of the bills, 1581, whatever y'all want to talk about.
This is Craig Tripkin with CASC. Just a comment or a thought, Joan. You mentioned what I don't remember the number of the bill, but the one with $50 million for sanctioned camping and 50 million. That one. It's my understanding, and I'm not current. I will confess, I'm not current at all. But it was my understanding that 30 million was to go into creating these structured campgrounds. But I guess from my perspective, importantly, 20 million was going into outreach efforts. You said something, you said different words, but you didn't say outreach, which I think is important.
$20 million to nonprofits, the professionals doing outreach, as well as, case management, hopefully, what we want to make sure that folks get access to housing. Yeah.
This is Richard Cruz. My understanding of this bill, when it comes to 1581, SB 1581, is just to explicitly put it out there, is the fact that one, cities would lose funding if they didn't comply, like if they've already accepted federal funding and they have the campgrounds, like if they didn't do it, is there like a piece within that? And then secondly, from our community who's experiencing homelessness, for those cities that had sanctioned campgrounds, if they did not go into those campgrounds, they could be arrested. Is that correct?
So, okay, I'm going to do your last question first.
Yes.
So it is my understanding that the most recently adopted amendments for Senate Bill 1581 removes the punitive law enforcement engagement. But that being said, I still believe, ultimately, sanctioned camping sites are what they want to create. So if you're in an unsanctioned camping site, they're going to enforce the camp or the either go to the sanction or, enforce the ban, which could be, jail or what have you. And so that does obviously cause concerns as ending homelessness advocates. So did I answer your question, Richard?
You did.
Okay.
Yeah.
Ask your first question again, because I want to make sure I understand it.
Actually, for the sake of time, I'd really just like to stop at that one.
Okay.
So that works. Wendy, and then also like everybody else, as always, we want to have conversation. I'm willing to extend conversation on this a little bit longer because it's it's still in the House right now. So we all do have the opportunity to organize around this bill and to advocate. So I'm supposed to stop this conversation in 4 minutes, but I will extend beyond that and take chair's privilege. So Wendy, go ahead.
Thanks. My question is related to Richard's. I'm concerned that sanctioned camping, is it going to be viewed as a shelter bed in a shelter bed count? Because that would change the police's ability to respond to illegal camping on public land. If there's campground space and they are not taking it, then that would become a trespassing issue. So while it's removed the punitive response, I don't believe we've addressed what this would be considered. And if it's considered shelter space, then are these camps supposed to have all the supportive services related to that? And is that in our choice as the providers? I think the camps down here next to Justice Center last summer were okay. But I am concerned about health and welfare of people staying in little tiny ovens all summer long.
Shared concern. I will, I know you guys can't accept chat, but I want to make sure you guys have access to the bill in its like most current iteration. Richard, Katie, is that a possibility?
That is fine. Yes.
Yeah, Joan, go ahead.
Okay, so I'm going to go ahead and drop the link into the most recent link, whatever, no, I'm trying to say, into the chat. So I want you all to take a look at the bill. But to Wendy, to your point, the bill language, as it's currently written, says that it would provide sanitary facilities, potable water, and on-site security to implement a progressive engagement case management model, be integrated into the local coordinated entry system for homeless services, set low barriers to entry for individuals experiencing homelessness, allow individuals to camp and store personal property, establish rules. And then I do want to say that it would, the Department of Housing is to establish the program, including site considerations, but also prioritize safe camping sites, but also may fund indoor encampment structures, tiny homes, or similar low cost structures that can be assembled quickly. And I think that that's to speak to that kind of sprung structure model. So I'm just letting you know the bill as it's currently written. But again, it was not written, the proponents of the bill is a group called the Cicero Institute. And they are not ending homelessness advocates like you all are. So, while they say certain things that I think, oh, well, we want low barrier and we want progressive engagement and we want integration into coordinated entry system, those are good, things, but I still have the back of my neck hair raised. So I need you guys' help to kind of help inform all of our concerns, right? Like you guys are the folks that are direct service providers. I am not. I need your guys' help to articulate what's wrong with it and how can we make this potentially palatable? Because like I said, it already passed already passed the Senate, which is typically the more, it's not the wild, wild west like the Arizona House of Representatives is. So we can kind of slow the roll typically in the Senate, but the fact that now it's in the House, we obviously have different strategies to employ, but we need you guys to help us with that process.
Thank you. Jim.
Joan, if you ruled the world, what would you use the $30 million instead of the encampment program? And if this committee ruled the world, what would we recommend as opposed to camps?
Oh, Jim, that's a softball question, but thank you for that. This is something that I testified in committee to say, permanent supportive housing is a much better investment than sanctioned campsites.
Jim's question wasn't rhetorical, guys.
Yeah, I would like to know what we feel about this.
Let me add one thing, just because, and I'm not. This is Craig. I'm not. I have mixed feelings about this bill, but I do want to point out that, Richard, you mentioned that cities would lose money if they don't enforce anti-camping. Actually, what it is they wouldn't get money. There's $50 million that would not be available to a city that does not enforce urban camping laws. So it's still an option on behalf of the cities. Now I realize that people don't like the idea of enforcing urban camping laws, but I get that, but I guess I guess it needs to be represented appropriately.
You know, and Craig, I respect that. I will say this, that the money I can't get, the money I don't get tend to be the same thing because it's still not money in my pocket. One of the pieces that I would encourage the group to really think about, and, you know, you can do the research for yourself on the bill, and I'll try to do my best to be diplomatic in it, is that oftentimes policy is written in a way to carry oppression on top of it, right? Period. And so, yes, it's great that they had stakeholder meetings to hear from us once they passed the bill. But the bill is passed in the Senate. And so once the bill gets passed, this will be one of those moments, potentially, or let us not find ourselves in a moment. There we go. I'm trying to be diplomatic. Let us not find ourselves in a moment where we wished a year from now, 2 years from now, 10 years from now. I know Stephanie talks about certain legislation that's been passed that, like, wow, like, I wish that we had been at the helm at the time that passed, so we could have said something different. Let this not be a time that we were silent and think about how this bill could be used. Because yes, as the Human Services Campus who operated the Safe Outdoor Space, there is value to sanctioned campgrounds. I will also say, though, that there's something about the criminalization of homelessness and how that is done through policy. And once policy is in place, it is not easily removed. So I would love to, I'll take like another 3 minutes to hear from anybody that would like to have their voice heard on this, but otherwise then like I'll move. So like another 3 minutes or so, because like we can't sleep at the wheel. Go ahead, Melody.
Yeah, I would just like to say I have seen a similar iteration, mind you, in a whole other state. So I'm mindful that, you know, I live in Arizona. But I have seen that. I will tell you, it was a strong factor in the similarities that it inspired the Veterans Justice Outreach Program here, because to your point, they criminalized a lot of loitering, where people were living, camping, to a point where as outreach teams, we had to assist homeless veterans to move away from where they were, literally pack up everything en masse. We're talking hundreds of people under a bridge. And what we saw, the outcome of that was it pushed veterans and homeless populations further out. We saw higher criminal activity because there was a bar as to where they could actually live. So I do have very strong concerns in terms of how this would affect our local community for homeless. Thank you.
Thank you. Other comments?
Richard, it's Wendy again, Wendy Johnson from Justice Center. The other concern that I have is the NIMBYism of these sanctioned campgrounds being put somewhere where there are no services or public transportation, which is more of a warehousing of the homeless than it is in ending homelessness. And so I think Richard's right. We just need to have our voice heard on this.
Jim.
Okay, I'm going to use my newbie title again because I'm new. Are we allowed to take a position on the bill that's
Katie
in question?
I think, yeah. So to answer this, just came up at the board. We would recommend that if you individually would like to take position and is it okay, and it is okay with your organization, please do so. The Arizona Housing Coalition has weighed in, and that is often where the COC itself directs action is through the Arizona Housing Coalition. But we do want you all to voice if it is okay with your organization.
So let me ask you this, Katie, though, but as the COC committee, could someone raise a motion if they wanted to ask if we wanted to take a position on this bill, and then that motion be carried and we vote on that yes or no, and then have that be the COC committee's position? Is that something that we have the ability and authority to do?
Currently, no, that is not something you can do. It will be revisited with the board during their strategic planning session next week, because the board charter currently says that everything goes through the coalition and you all fall into that same charter. I will share that some of the challenges with that are who is weighing in, how do we delegate the person that is weighing in on behalf of the committee, and you all wear so many different hats. You don't just wear the hat of being on the committee. And so we want to acknowledge that and weigh that out. And so this is something that we are bringing forward with them.
Okay, so we'll go Jim, we'll go Joan, and then I'll move.
So if we move things through the Arizona Housing Coalition, and the Arizona Housing Coalition is saying X, shouldn't we also say X?
I can speak to the Arizona Housing Coalition. That's all I can speak through. You know, obviously, speaking through the Arizona Housing Coalition, again, if the COC committee has a different stance than Arizona Housing Coalition, that's going to create some conflict. But we would, we at the Arizona Housing Coalition, or a statewide organization representing folks, many of you on the phone, addressing ending homelessness and affordable housing, we'd love for you to share our opinion. And to the kind of to Richard and Katie and Jim's concerns or comments, I'll just say a couple potential calls to action. One, it's not just, while you know MAG is often apolitical, the Arizona Housing Coalition does take stances at the legislature, as does the League of Arizona Cities and Towns. So I think it's through those two mechanisms, those two professional associations, that MAG kind of directs some of their activities. That's just kind of what Joan's perspective, opinion, whatever is. But I would encourage, you know, to Richard said, you know, something about you can speak on behalf of your organization, but don't forget you wear the number one hat that's most important is you as an individual. You as an individual, you can make your voice heard, and let your lawmakers know. We will be doing calls to action once we have kind of a real comprehensive and informed written up narrative of our concerns around Senate Bill 1581. And I'd ask that you all echo that messaging to your lawmakers, identify who your representatives are and make your voice heard. You guys are the professionals in the field. I think that's my, oh, and then join, you know, obviously if you're not a coalition member, you know, consider joining us. We have, as Jim is now painfully aware of, we have policy committee meetings every other Friday, and you know that's where we have in-depth conversations around it. And again, it's your guys' voice that help inform and inform our decisions.
Thank you, Laura. 30 seconds or less. I'm sorry. We just.
No, I know. This was just a quick question. I'm curious how the Bureau of Land Management or the Parks Department or even Parks and Recreation is looking at this particular bill. Are they for it or are they against it? And are they working? What side of the aisle are they on?
At this current moment, I don't believe the BLM is part of or has weighed in on it. It's frankly up to the Department of Housing to help create policies around this. But it's also incumbent upon the cities and jurisdictions to identify the sanction camping location. And they're gonna, I mean, as many of our local jurisdiction partners who have reached out and expressed some concerns, not only are they worried about the constitutionality, but they're also worried about the NIMBYism concerns that exist.
Thank you.
Thanks, John.
So, in closing, there's 33 of you on this call. So often legislators say that they don't hear from anybody about these bills, and the rule of 20 will tell you that 20 people can make a huge change because the squeaky wheel gets the oil. And so by all means, I encourage you to reach out to your legislators in the House, whether you are in favor or you are against this bill. At least your truth would be able to be heard. But of those 33 people, that means you're also 33 different organizations, which means that's 66. So I would encourage, if you have the ability to speak from your organizational standpoint, to do that, but also you are constituent, you all live in Arizona, and so you have the ability to reach out and touch someone. So please do, AT&T. Now, as we move forward, Stephanie Crum, HMIS Manager at Solari, will provide a recap of the system flow dashboard and a breakdown of the subpopulation data by ethnicity. After reviewing the dashboard and presentations, we're going to discuss next steps, right? So I encourage y'all to get in on the front end of the conversation so we can have like really robust conversation. And then when I'm not trying to like sneak you in, like at the end. So after Stephanie is finished, we'll also hear a recap of the system flow synthesis by Katie. Go ahead, Stephanie, it's all yours.
Hello, thank you, members of the committee. Good morning. Let me go. I know we're short on time, so I'm going to go ahead and share my screen and we will dive right in here. All right. Everybody see my screen okay? A thumbs up? Yeah, yes. Okay. All right, before we get into numbers, I do want to just point out that we did go ahead and add some more definitions down here, just if you're looking at this board and need some more clarity. We did include our by name list exclusion criteria, and then also the positive exit destinations out of HMIS. So if you're on the landing page, scroll down, and we've got some more robust definitions there. But let's go ahead and get into numbers here. There we go. All right, so just an overview looking at our total number of active households. We were experiencing a bit of a decline, but it looks like from December to January, we're starting a little bit of an uptick here again for all households. This does appear to be driven mostly by the singles population as opposed to families, so there is a bit of an uptick. It's not as significant as with the singles population. As we scroll down here to our active subpopulations, again, we can see this uptick taking place most prominently here in our BIPOC population. You can see that unsheltered is actually tracking down. So this isn't driven by the unsheltered population so much. We do see some uptick here too with our elderly population, a little bit concerning there. Veterans, we are seeing, we're still aligning our numbers right now with the VA. So this will continue to come down as we align both our by name lists and our active numbers for veterans in the system. All right, so popping over to our flow details here. We were seeing, again, back in November seeing our outflow pace our inflow, which was great. It did sort of close the gap there in December. And then now again, we are seeing our inflow outpace our outflow. What's driving this does seem to be the return from inactive number. Really seems to have jumped from December to January. Not really we're seeing a few returns from housing, a little bit more of an uptick there as well, but it seems mostly driven by return from inactive. And then again, down on our outflow detail, you can see our negative exits were tracking down, but now they've started to track back up a little bit. And our total house did drop just a little bit here for January. So things to keep an eye out over this next quarter to see if this trend is going to continue. Any questions about the dashboard real quick? Or any of the numbers? I can't see hands, so I'm sorry. I can only.
This is Jennifer. Jennifer, I do have a question about. Yes. Thanks, Stephanie. The returns from inactive. Mm-hmm. You said that was kind of contributing to the uptick that we were seeing. Yeah. Would that be like associated with like an increase in engagement or like outreach, or like what does that kind of look like from your perspective? A return from inactive.
Yeah, absolutely. So when we look back at our definitions, when we're looking at like, what does it mean to return from, inactive, that's basically what it means is someone who didn't get housed, but, fell out of engagement with, either shelter, outreach provider. So yeah, that would be indicative to me of, increase in either outreach or folks being able to access shelter because they're coming back into the system by one of those ways. So yes, I would conclude that.
Thank you.
Yeah, absolutely. Thank you. All right, awesome. As always, if there are any questions, go ahead and please reach out to me or to Katie, and we'll get those questions answered for you. All right, so then I wanted to go ahead and look at what we looked at last month. We did a little bit of a deep dive here into the race ethnicity breakout of our subpopulations. So what I want to do is just give a little bit of a quick recap of what we talked about last month, and then talk about the additional questions that came out of that, and then some conclusions that I think you all can really look at as far as some change ideas. So let's go ahead and dive in. So the questions that were initially asked were, we really just wanted to look out the breakout of race and ethnicity across our subpopulations, like aging, youth, BIPOC, unsheltered. We really just wanted to look at what that looks like, especially compared to system-wide, and if there are any increased disparities in a subpopulation versus the total system. Some additional questions that came out of looking at that was, we really wanted to look at like who is reporting disabilities on our by name list, but is not considered chronic. They don't have a chronic status. And then we wanted to look at how valid is this data that we're looking at? Like how much of this active list haven't reported race ethnicity? What does that look like? So we looked at race by subpopulation, and immediately you can begin to see some of these disparities. So over here, all the way on the left, we had our all households and the percentage of representation. As you scroll across, you're going to see families, as we saw last time, have a 15% higher rate of disparity here. It's also prominent here for youth, for our youth population as well, for Black families. We're also, if we had the additional question of breaking out what ethnicity looks like, so I went ahead and did that. And again, over here on the left, we've got our all households, blue representing Hispanic and Latinx households. And again, you can start to see there's a bit of a disparity here for families, but it's really prominent over here for youth. We're looking at about 12% extra disparity on top of what they're already experiencing in the total population. I just wanted to look at it normalized again to the total households, just to really emphasize these disparities. So again, you can see that families are 15%, Black families are 15% over the disparity, white families are 15% underrepresented. And then you'll see these, this here in the youth, Hispanic, Latinx, 12% over as well. Just a different way of kind of looking at those disparities. Moving on to the next question about chronic status, we wanted to know how many folks on our active list are reporting a disability but have not obtained chronic status. And the results of that were 1,245 people, or 42% of all of those reporting a disability on the by name list are not chronic. So it's a significant portion. I thought that was something to note. And then our next question here, we really wanted to look at how reliable is this data? So typically when we're looking at whether we can use a data set and whether it's reliable enough to use, 15% is the threshold for reliability. When we look at our total system-wide here, we're looking at our universal data elements. So these are like your name, social security number, your race, ethnicity, gender, disabling condition. System-wide, we're over 97% completeness. So what that means is that those who don't report any race or ethnicity on our by name list or active list is less than 2%. System-wide. And then we see that reflected here in the active BNL. Those not reporting race or ethnicity on the BNL is about 1.2%. So what this tells me is that we're well under the threshold for reliability, and that we have a really, like system-wide, we have a really good data set here to be looking at this, to be looking at these issues. So just a real quick recap, we looked at the breakout of race and ethnicity, and I think it's very clear that we have some target populations here. Black singles, Black families, Black youth, Hispanic and Latinx families, especially youth, are experiencing even greater disparities than they already are across the households in our total system. We looked at who's chronic and who's not, and we can see that, or who's reporting a disability and who's chronic. We can see that there's quite a bit. It got a little messy, so I didn't prepare a visualization, but I did look at the race ethnicity breakout of the folks who are chronic reporting disability and not chronic reporting disability. And we see the exact same disparities, almost to the same percentages with the BIPOC population. So I thought that that was something to note, that they are also less likely to be considered chronic. And then how valid is this data? We looked at the reliability, and this is a really clean and reliable data set. And yeah, I think that we've got some really good information in our system here. So if there are any questions, again, please reach out to me, stephanie.crum@solari-inc.org, or if you have any just general questions, HMIS, please reach out to my help desk at hmis-support@solari-inc.org. I'll open it up for questions. Yes, but I do think that we definitely, I think, have enough information here to make, whether that be policy changes, funding changes, priority changes, to help our BIPOC population. So thank you.
Thank you, Stephanie. So, you all have seen the information. What are your responses? What's going on for you? And what do you want to do with it, most importantly?
Richard, you have a series of hands up. Can you see those?
I can't see them. Can we?
Awesome.
Oh, let me stop my share. Hold on. Go back to the screen. Can you see them?
There we go. Okay, Michelle, go ahead, and then Jocelyn.
Yes, I appreciate the disability data. I'm very much interested in that. The fact that 42% of the chronic is showing as people with disabilities. What that tells me is that we need to look at the funding levels for accommodations, because for people who have hearing loss, for people who are blind, people who are wheelchair users, without additional funding for accommodation, social service agencies are going to get stuck with that. And that is something that I've heard before, is that in some areas they won't allow a person in a wheelchair, or the facility is not accessible. And so, that data is very important. I would love to see Maricopa Association of Governments drill down in that area, because one, that's my expertise, but I'm very much interested in the data, where that came from. Thank you.
Thank you. Stephanie, can I just revisit that data point? Just so I'm clear on it.
Mm-hmm.
In that data point, you had said of those that are chronic, no, of those that report having a disability, that 42% of them are not chronic. And so thus 58% of them are considered chronic. Would that be?
Yes.
Okay.
Yeah, that is.
Okay, thank you so much.
Yeah,
okay, Jocelyn.
Absolutely.
Thank you, Stephanie, for the data. My question is more so like towards the board, like how, and does anyone know how involved they are? I mean, just given, the recent data, has this been presented to the board? Are they taking this, seriously? Are they doing, work around policy changes? Are they having conversations about any of this? Just out of curiosity.
Katie, can you speak to that?
Yep, members of the board, Jocelyn, or members of the committee. They were recently presented with the system flow dashboard synthesis, which directly called out the change in people being served, especially for families. So Black families being disproportionately represented. They have not spent a ton of time diving into this specific data. This was just finished in the last few days, so the board has not met. But this will also be going to the racial equity group to start to talk about next steps.
Thank you, Katie.
Thank you. Vanessa, I saw your hand was up.
Oh, I accidentally hit it, but I am interested to see what the racial equity group comes from with this, because I think that there are some ways that we can address those disparities in how we allocate the resources with permanent supportive housing, rapid rehousing, all of our housing resources. How are we allocating that towards those target populations? So those are just my thoughts. Thank you.
Thank you. So one way I'd like to flip this question to say, like, we've seen this data. This data was more of a confirmation for us than it was a new revelation in regards to where these target groups are. I'm curious what is currently being done by members of the committee. As a result, I mean, like, we've been swimming in this data for years, but we've been really focusing as a committee. We've taken some additional time the last 2 months to really dig in. And so I'm curious what people are doing, or what changes they're making, or what changes they want to make within their organizations, and what they're seeing as a result of that. Jocelyn.
I can just kind of report from the racial equity meeting that we had Monday for the COC, that it's very exciting what we're doing, and I don't want to say it just yet because we're doing a lot of researching, but it's definitely going to be targeting Black families and trying to put program services around getting them housed quicker, because we know that that's also a disparity, that it takes Black families at least 6 to 7 times to apply and secure housing when they're renting. So we have some ideas, and we're getting some feedback from a couple of organizations who have a surplus of Black families. So hopefully we have something to report at the next meeting on the movement that we're doing in that, but we are actually taking action steps, which is super exciting. And again, so hopefully next meeting we'll have something to report.
Awesome, thank you. Other things that are currently happening in regards to this type of work, Laura?
I just had a quick question related to MAG and the continuum of care and the overarching numbers of Native people showing up in the subpopulations, and how are we working with the tribes to try and solve some of this problem?
Members of the committee, Kelly, if you want to add anything, feel free to do that as well. But we are our 4 tribal entities within Maricopa County MAG region. We are actively working with, specifically trying to figure out next steps. We know that tribal homelessness looks very different than urban homelessness, but these are folks who are choosing to live urbanly and not choosing to live on reservation. So it's kind of a both and approach of serving folks who are here in our region, but then also working with tribes to determine, like, is there more housing that could be available on tribal land to serve those folks too.
Thank you.
Thank you. So we have to move so that we get back on track. However, one thing that I would encourage you all is to try things out. You know, it's great to watch the Food Network, but if you don't get to eat one of the recipes, it doesn't do you any good. And so within that, if, you know, the worst thing we can do is nothing. And so, like, as we present this data, I would encourage you all to try small tests of change, to try something to see what is it that what are the adjustments that need to be made for you all. This way, we're not just watching train wrecks happen and then saying, like, wow, that's a big train wreck. Moving on, the next part of our agenda will be going to Katie. So hold on, let me just cue that up real quick. Katie is back with us, as she's always with us, to give an overview of the system performance measures and how they are measured and what the current metrics look like in our community. This will be an item that we look at quarterly, reviewing the metrics and how we can begin to improve the system. Go ahead, Katie.
Hold on. Okay, I'm hoping you can actually see it in presentation view. Is that true? Yes, awesome. Really quick before I go into that, we did include the quarterly synthesis in your packet for your review. That was presented to the board and you all requested to see it in addition. If you have any questions, feel free to reach out to me, but that will be more publicly available besides just the dashboard for folks. So if there are people you wanted us to send it to, let us know also. So as Richard said, this is something that you all will be reviewing on a quarterly basis, but given the fact that most of you, or I guess a big handful of you all are new, we wanted to go through what the system performance measures actually are, and then we'll start to review them on a quarterly basis, looking at the changes and how we can begin to improve as a system. So really the goal of today is to give you an overview of those and then review these. So what are our system performance measures? They fall into 4 big categories. We want to make homelessness rare, brief, and non-recurring. In order to do that, we look through jobs and income growth. So these are all the different metrics that I will walk through and talk about, like, what do these numbers mean? But HUD is really focused on kind of those 3 big bullet points of rare, brief, and non-recurring. So the first one that falls under rare is the number of persons experiencing homelessness. This is specifically looking at the point in time count. So obviously we've continued to see numbers grow over time. This has been a trend since 2014, especially among our unsheltered numbers. So that is something that we know is a reality. It's a reality across all big cities and urban areas, but is going to continue to hurt us when we look at our system performance measures. The next one is looking at reducing the length of time homeless. So this is really, we're trying to understand how can we reduce the total length of time? This is an amount of days, including emergency shelter, transitional housing, and safe havens. As you can see on the left side is our 2020 system performance measures. That is on a federal timeline. So it's from October 1 through September 30th of 2020. The second thing you'll see is we run our system performance measures on a quarterly basis. So this is something that our HMIS team does proactively so that we can start to see our trends and figure out real time, how do we respond? So in Q3 of last year, which is a calendar year, so that would be July through September, we saw that our length of time homeless was 102. So we were trending in the right direction, but then in Q4, we went up to 104. So from October to December, we were back up. Our goal is 98. We're obviously still pretty far away from that. And so we need to figure out how are we going to start to reduce that length of time, again, in shelter, transitional housing, and safe haven. This is inclusive of all programs. So any program that is in HMIS gets pulled into these system performance measures. The next one we're going to look at is reducing returns within 1 year. So this is people who, the percentage of clients who exit into housing and then within 365 days return to the homelessness system. It includes permanent housing exit from all program types and then return to entry to any homelessness program. So whether it be shelter, outreach, any of those not supportive service programs. In 2020, we were at 18%. In Q3, you saw a jump up to 20%, but now we are back down to 17 with our goal being 13. So we're seeing a desired trend of down and our actual trend is down. So we just need to continue this trend. The next one you see is increasing jobs and income growth. So this is the number of people for COC projects only. This is the only metric that is only for COC projects who had an increase in income, either job income or non-employment income. So non-employment income would be Social Security, disability, any of those things, or actual employment income being they were working and increased that income. In 2020, we were at 50%. In Q3 of 2021, we had dropped significantly, but then in Q4, we were back up. The goal of this is to get anywhere above last year. So 50.01 is good enough in our book, but obviously not good enough to change the system as a whole, because we know that people need income in order, especially with the rising market. Included in this are all program types that are COC funded, and our desired trend is up, and we are now in quarter four, trending up also. This one is reducing first-time homeless. So this is the total of clients entering a homeless project without a prior entry in the past 24 months. So that means they haven't touched the Maricopa County HMIS in the last 24 months. As you can see, and as we've all felt, we know we're having a rise in people experiencing homelessness. In 2020, we had 8,800, but we're just continuing to see that grow. And now in quarter four, we were at 10,792. Second to last one, increasing successful exits to permanent housing destinations. So this is the percentage of housing exits from emergency shelter, transitional housing, or safe haven into a permanent housing. So that would be rapid rehousing, permanent supportive housing, or diversion to a safe friend and family, something that is going to be a place that somebody can stay, a positive exit. In 2020, our system performance measures were 48%. We are trending down, so our goal is 53%, but as you can see in quarter four of 2021, we were not there at all. We were at 40%. And lastly, increasing successful permanent housing exits to permanent housing or retaining housing. This is specifically for permanent housing projects, so it excludes rapid rehousing, and it means that people either retained their permanent supportive housing, or they moved into other permanent housing, for example, a PHA voucher, or paying rent on their own. As you can see in 2020, we were at 96%, and we've continued to trend upwards, so this is one that we've been pretty successful at. Happy to answer any questions. As I mentioned, we will be reviewing this on a quarterly basis and talk about how we can continue to improve. The other thing to note is that the board is seeding their entire strategic plan in these measures. So this is something that is a huge focus for them, and they would like it also to be a focus for you all.
Thank you. And then there we go. So I can see. So you all, as always, like we've seen the data. Laura, I see your hand. So coming in hot, go ahead.
I just had a quick question. Since the entire state is now on the same home HMIS system, I'm curious if we've looked at, for the reduction of first-time homelessness, if we've compared across continuums to see if that's really first-time homeless in our area, or if there's potential for people moving from, up north to the valley or vice versa.
Members of the committee, Laura, we actually are, even though we and Balance of State share share Solari, we actually still have two separate systems. The LAP data warehouse project, the learning and action and policy and programs is what LAP stands for. They are working on care coordination and doing data matching across, but that is not something that has been developed at this point. It's still in development and will be one of the things that they investigate.
Thank you.
Thank you. Other questions, other things that are jumping out to you about this data? Jennifer.
Hi, everyone. So I have a question, and maybe it's not appropriate, but I guess I'm thinking, from this presentation, we have some targets, right, as a system, and some we're meeting and some we are not. What do we do about that? I mean, other than just tracking the data, are we breaking it down to see if there's specific providers who are struggling, who could be provided like technical assistance, or what would make those numbers kind of be at the target for us as a community? I don't know. Does that question make sense?
It makes sense.
Okay.
Katie, do you want to answer first, and then I'm gonna throw it out?
Sure. I don't know if I'm stealing your talking points, Co-Chair Cruz, but Jen, our intention would be that over time you would start to look at providers and seeing what improvements can be made over time. These are something that the CFC these aren't necessarily all CFC grants, right? So we're looking at community best practices, figuring out how can we bring providers up to speed with those, but really is driven by you all. It's not like something that a monitoring could do because they're not necessarily our grants to monitor.
Thank you. Yeah, and I'll go to you next, Christina, but I want to give that a little bit of time and breath. Like in looking at some of those actionable areas, what are the things that folks are doing within their organizations to reduce length of time when it comes to homelessness? When a lot of those system metrics, even if it's not working yet, what are you doing? Or is it just folks are homeless outside and that's what it is? Like, I don't believe that that's how we're operating. So does anybody want to share? Okay, so I will say from a human services campus standpoint, okay, there we go. I will say from a human services campus standpoint that we are, that is one of the key metrics that we are driving towards, is really understanding what it's going to take to reduce the length of time for folks experiencing homelessness, increasing our engagement. We've hired a night manager so that we can have better engagement at night with folks and make sure that folks are getting progressed, so that they're not just staying in overnight shelter with us, but that they're staying in overnight shelter and being connected to services during the day that wasn't currently happening at a robust level before. I would hope that, we're able to take this data and dig into it a little bit to see like, what is it that we're currently doing that should have an impact on those numbers. Christina.
Thank you, Richard. Christina with Native American Connections. Some of the things that stood out to me, Katie, when looking at your numbers, was the reduce in returns within a year. With that increase, some of the biggest things that I thought about is the individuals who are given vouchers of some kind are not necessarily given the correct assistance. We have individuals who are scoring for rapid rehousing, but are not necessarily being most truthful with the VI SPDAT. Also, the VI SPDAT is not culturally sensitive to a lot of individuals who consider, sleeping on the floor at residence houses as a way of being housed versus homeless. So they're not necessarily talking about how long they have been homeless or without an actual permanent residence. So then they're given that voucher and, within 9 months, they're back out on the street and they're returning to homelessness. So I think just really looking at the tools that we're using to assess these individuals before giving them the voucher may be something that we could look at, and assessing their level of needs as well. There's a lot of different angles that we should be looking at versus just a score. Also, going back to the reduce and the first time homelessness, we know the housing market is terrible, even for individuals like us. So I think that also taking that into account and putting more money, again, like we've said before, into housing and making it more affordable, and giving those additional units for permanent supportive housing would be a way to kind of drive those numbers, I think. That's just my opinion.
Thank you. Thank you for that. I saw Marcy.
Hi, I just want to thank Christina. I think that's a great point about making sure that we have the right intervention matched with the right person. I do think that is really something that we have to make a concerted effort in doing. But home is also, now we have threshold here for Maricopa County offering landlord incentives. I'm hoping that that's going to carry on to incentives for renewals, and encouraging our property owners and agents to renew rather than raise the rent so high that we can't keep up with the payment standards. So hopefully, we are boots on the ground trying to make this happen. I know that we've had some conversations, obviously, about affordable housing and the lack of units and the need for more. So I would hope that we can put a little more attention to our developers and see if we can get more units and make it more inviting for them to participate with our programs. Didn't have a question, just really wanted to comment on that. Thank you.
Thank you, Marcy. Michelle.
Yes, one of the things, like when someone gets a voucher, there's a cap on the amount of rent that a person can, assume. With the rate of rental increases, has that cap changed at all? The thing is that, I've seen 3 people that in the last 3 weeks that the rents have increased, they have to leave. All 3 of them have disabilities, severe disabilities. One quadriplegic, one is blind, one is a wheelchair user. The one who's quadriplegic ended up going back to a group home scenario because of lack of being able to find affordable rent, even though they had a voucher. So that is something that with our rent rising so high right now, is how do we change that? I know it's a federal thing, but how does that get changed?
Jessica Cruz here, Housing Authority of Maricopa County. I can speak a little bit to that. So there are, the fair market values, and then also there's 100%, 120% cap that we have to stay within. And recently HUD has released some waivers for PHAs to apply if they have the funding to do so, based on the money that we've been provided. So you can apply for a waiver. It's really just based on the PHA's funding availability, and even then, it's you can only go up to 120% FMR. So it really just depends on what's available, and even then, we're still seeing the housing market exceed that. If somebody doesn't have income, it really is challenging. So I hope that answers your question. There is some flexibility, but it really just depends on what the PHA has within their funding availability.
So, Jocelyn, yeah, Jocelyn, go ahead.
I'm sorry. I feel like I always cut you off when you're about to say something.
You're good.
Just really quick, and just kind of to be, the devil's advocate for the participants out there who are, in the trenches of this, searching for housing. I'm just curious, what are service providers, offering as far as extensions, and are folks being terminated for not being able to find housing before their vouchers expired? Is there additional time on top of extensions that's being given, to kind of compensate of what we're seeing across the board with inflation and things like that?
It's a good question.
Hi, Jocelyn. This is Vanessa from ABC. I'm sorry, Richard, is it okay?
Yeah.
I'm sorry. I just wanted, Director of Housing at ABC, we hold a lot of permanent supportive housing programs. We do provide extensions. It's the first 60 days is their search time, and then we can extend past 90 days, and then we have an appeal process if there's searching beyond that. And I believe that's a pretty normal and consistent process across the board. I'm sure managing multiple housing programs has an idea about that.
Yes, we actually will extend out to 120 days, and then they are allowed to appeal from there. Sorry, Marcy from Homing. And we also, we're working with providers, and whether that's supportive services or case management, and really urging them to work with their hardest to house, who have the high barriers and transportation. We're trying to do a lot more coordination than we've ever done in the past, to make sure that the searchers are getting out to the properties, along with making sure that our pad mission information is as current as possible, so that they can see what units are available. So yes, there is a lot of work in the extensions to answer that question.
Thank you, Marcy. So we have to move because I want to get everybody out in time, and we've got like one more agenda item that we have to hit. But this conversation is a good example of things that when it comes to how policy impacts us all, or lack thereof, when it comes to lack of housing policy around like rent controls and things of that nature, how it impacts our population. And when we talked about what we did earlier around our ability to advocate and speak to our legislators, these are the conversations that we need to have. So awesome. So next, the ESG subcommittee is responsible for overseeing the ESG and COC written standards for administering assistance. Last meeting, we asked a work group to come together to review the standards. Katie will provide a recap of the work group and ask the committee to add any additional comments. Go ahead, Katie.
Thank you, Co-Chair Cruz. So the committee met last week and discussed really kind of mostly the financial standards within that policy. Most of that is federal HUD requirements that can't really be impacted, but the biggest one was the rapid rehousing financial dollars. So the biggest kind of like feedback from that group was the intention of the limits are good, but we need to have more flexibility around it. So there's concern that every ESG provider has kind of a different line of how they do their ESG. So if there could be some consistency without a price cap on total dollars that can be given. And then also if there is an easier way for you to request a change. So how it's currently written is that 0 to 3 months, you can pay 100%, 3 to 6 months, you can pay 66%, 6 to 9 months, you can pay 33%, and then 9 month plus you can pay 6 to 12 months you can pay 33%, and beyond 12 months you can ask for an extension. And really what the feedback was is that we need to have a smoother process for asking funders if we're going to keep that funding ask, and if there is a different process for that. The suggestions were really, could it be staffed and approved by a supervisor? Could there be a uniform form to review and submit to the funder at the end of the month instead of needing permission prior to moving forward? Or could there be a set of criteria based on examples provided by providers to say like, yes, this would work, or we have an extenuating circumstance that needs further kind of funding consideration. The other conversation that really came up was the change in income limits. So it can be really difficult to serve people because the income limit is so low, but then in this market, it is really difficult to house people who have like such a limited income. If there are, I will A, ask for feedback if you have any other additions, but also B, ask for you to vote on this today.
Thank you, Katie. Are there any other comments or discussion from the committee about what Katie has just presented? Okay. If there are none, could I please have a motion to approve the ESG and COC written standard recommendations to the ESG subcommittee?
I motion to approve.
Okay, it has been moved. Is there a second?
I will second.
Thank you. So it has been properly moved and seconded. Are we ready for the question? Okay, Katie, go ahead.
Don Bogart.
Aye.
Melody Boyer.
Sorry, microphone issues, yay.
Vanessa Cardell.
Yay.
Sylvia Chavez.
Yay.
Ashley Zagonic.
Aye.
Erin Cohen-Haig.
Yay.
Jessica Cruz. Jessica, you're on mute. Kathy Dinolfi.
Yay.
Bernie Peralta.
Yay.
Nicole Gibson.
Yay.
Anne Marie Johnston,
Yay.
Christina Lopez,
Yay.
Marcy McFarland,
Yay.
Jim McPherson,
Aye.
Jennifer Page,
Yay.
Gerardo Pena,
Yay.
Laura Scott Nicky,
Yay.
Lynn Spillers,
Yay.
Jill Stokes,
Yes.
Craig Tripkin, Jocelyn Wilkinson.
Yes.
Thank you,
Yes.
Craig. Jessica Cruz.
Yes.
Co-Chair Cruz,
Yay.
Co-Chair Johnson.
Sorry, I'm not used to my new first name, co-chair. I agree.
Did I miss anybody? All right, the motion passes unanimously. Back to you, Co-Chair.
Awesome. So thank you so much for that. Just very quickly to share what's in the chat right now so that people know. So one, Jim put in the RTS system. The RTS system is how you can give a thumbs up, thumbs down, or speak on a bill. You would need to register for the RTS system if you want to go speak in committee. If you just give your comment, that'll be read, but also they like to see smiling or not so smiling faces as well. So that is in the chat for anybody who needs to see it. I will now go to the next agenda item and pass it back to Co-Chair Wendy Johnson.
Thank you, Richard. We are at topic number 9. Do committee members have any action or discussion items for future meetings?
Yeah.
Jennifer Page.
There, I don't know if this is already on the agenda, but I know I had reached out to Wendy and Richard and Katie regarding a presentation for the committee. And I think there was some discussion around maybe having like a quarterly ad hoc meeting or something for that.
Correct. And I am sorry, I can't answer right this moment what our time frame on that was, but I know Katie is working on it. Katie?
Yeah, Co-Chair Johnson, Jen Page. We are working on putting together a series of trainings in coordination with the Arizona Housing Coalition. Our target is to have that first one focused on employment that will be open to all in April, but we will have dates upcoming. And you can look out for our COC newsletter. It will be included in there as a way to register.
Okay. Jim McPherson, your hand's in the air.
Hi. At the last meeting, I had brought up the idea of a communications committee to help communicate all the things that we're doing or the organization is doing. And I understand through the grapevine, and that would be Katie, that another organization or another body within this umbrella organization is doing such a thing. Katie, can you provide an update on that?
Yes, members of the committee, Jim, the board is currently looking at an entire communications plan through their strategic planning, and as a result, trying to determine what is the best next step forward for communication between each of you all. So between you all, other subcommittees, and the board, out into the community and then into the COC. We are meeting next week to discuss next steps and to determine if it is going to be a communication subcommittee or is it going to be a certain group within the COC that would be responsible for that communications plan.
Thank you.
And I will keep you all posted, especially you, Jim, because I know you're interested.
And to those of you that brought these things up, thank you for continuing to niggle and remind. It seems like the time between our meetings goes very slow sometimes and then really fast. So we need to stay on top of these to begin working together to the best of our ability. If I don't see any other hands, if anybody has anything to add, we can wrap this up. Katie has made note of those things. Oops, we got a hand. Richard.
Yeah, are we on the comments portion?
No, I'm moving there right now.
Okay, I'll just wait.
I'll put you number 1 after
Okay,
me because I have a comment too. So Comments from the committee. This is an opportunity for us to share any announcement or events that we'd like to highlight. So I'd like to start by saying that if you aren't aware that Social Suds and the Phoenix Tool Bank are holding a yard sale for providers like us to get rid of overstock on items and raise community awareness. It'll be April 1st and 2nd. No, it's not a trick. It's actually April 1st. And if you'd like more information, reach out to me and I can connect you with Social Suds if you don't have that information. But it's a great opportunity for us to redistribute some of our excess wealth that's hanging out in our storage areas. So that's my announcement.
So last time I met with you all, I told you about the 738 individuals that were sheltered outside of campus or unsheltered outside of campus. And since that time, we have now exceeded the number. This week's number was 908. The week before that, it was like 940. 940 people unsheltered around the campus. I just want that to sink in for folks. And so just like there's just a critical mass of individuals that's never been this high, and on top of the 600 to 700 people that are on campus every day. Sheltering on March 29th at 5:30 like 5:30, like 5 to 7, sorry. We're going to do a count, like a pit, almost like a pit count directly around the campus so that we can know as much as we can about that demographic and what's the profile of those individuals that are around the campus. If anyone would like to join us in that effort, you can reach out to me and I'll connect you with Andrew, our outreach coordinator, who's putting the event together. But because we're going to be doing it from roughly 5 to 7, you'll still be able to get to work on time. So feel free to come out and join us, but we definitely need to do something. We can't just sit here and do nothing while we have almost 1,000 people unsheltered around the campus.
Richard, that's 5 a.m., 5 to 7 a.m.
Yeah, morning count, early morning count. I see Wendy's mouth moving, but I can't hear her.
I'm chatting away here to myself. Jim McPherson, I see your hand up again.
Yes, I noticed that the Arizona Housing Coalition annual meeting is April 12th through 13th with registration online, and I can put that in the chat if you'd like.
And an excellent segue to another announcement, which is our meeting falls during that time. And we're going to move our meeting up to April 6th. Katie will send out a calendar change for that meeting. But we encourage everyone to be a part of the Housing Coalition conference. Okay, it's 11 o'clock. If there is no further business, anyone? Thank you for the panelists who were here today, for the proxies, for the presentations, and those who attended from the community. We appreciate all of you very, very much. And if there's no further businesses, we are now adjourned.
Thank you.
Bye, everybody. See you in a few weeks.